Hello, friend. Happy Friday. It's finally here, time for the weekend, and it's so nice and sunny outside today. So I thought I would come to you from my back porch today out in the sunshine. So this is something that I talked about this week in my email, and I know some of you are thinking, okay, you told us the exact opposite earlier this week, but I'm actually talking about a different group. So it is so important to share. And I know earlier this week I said sharing too much can be harmful. And so the group I'm talking about today is staff members, other employees, the people you report to, your committees. So as an IP, we have a lot of information that we are collecting, that we are monitoring and reporting, and it is so important that we are letting others see that information. And I want to talk about why it's so important. If you've come to any of my master classes where I talk about getting started in IP, one of the sessions or one of the sections of that master class, we talk about how to engage other people, how to actually compel them to be compliant with the infection prevention recommendations that we have. And one of the things I've talked about is establishing relationships and helping them to understand the why. Why are you asking them to do this? Why is this important? Why is this not just another thing that you're asking them to do, to take away, just more busy work? And so one way that you can connect the dots and communicate the why is through sharing the data or the information that you have. So for instance, if you're collecting hand hygiene data and everyone knows, you've been going around talking about how important hand hygiene is, how important it is that you're foaming in and foaming out and washing your hands. And everyone's just thinking, oh, here comes Missy again. She's just, on a power trip or trying to boss us around and tell us what to do. But when you have that data and you can say, hey guys, listen, we were at 50% last month. Does anyone think that's acceptable? And I don't think that anyone's going to say that it is. This is why I'm coming around to remind you, because did you know whenever we had that 50% hand hygiene compliance rate that we also had an increase in infections? So see how I connected the dots there between we're not doing well with hand hygiene and we had more infections. Now we can see the impact on the patients. It's not just about me and you doing the hand hygiene and going through the actions. It's about the impact on the patients and how our actions are positively or negatively affecting our patients. And so it's connecting those dots for the healthcare providers, for the administrators, for your boss. Why is it so important to connect the dots for your boss? Because when you go start asking for resources, they need to understand why what you do is important and why it makes a difference whenever we don't have enough hand sanitizer, when we don't have people to do hand hygiene observations. So it's a different method depending on which group you're talking to. You may present the data a little differently, but it's the same concept that we're using the data that we're already collecting, and we're using that to connect the dots between a behavior and the impact on the patient. Now, you can also do this with positive results. Maybe your hand hygiene is looking great, which right now I know a lot of people's looks great, and I'm so happy about that. So if your hand hygiene is 90%, okay, let's communicate that back as well and use this as an opportunity to actually give someone a compliment or reward them rather than it happen to be a negative interaction. Let's flip that around and say, hey guys, our hand hygiene was 90% last month. That is awesome. We are doing so good. Thank you for your hard work. And if your infections were down that month, again, connect those dots so they can see the positive outcome from them doing this correct behavior. our hand hygiene was 90%, and look, we had 0 infections, or we only had 2 infections, and last month we had 5, or whatever it is. Try to connect the behavior that they're either doing good or bad with the outcome to the patient, and share that information. Don't keep that to yourself. It's important to share that information. Now, you may not want it out in a public place. That's not always the appropriate place to share information. You may want to keep it in an employee area, or you may even want to go to staff meetings and share it one-on-one and answer questions with people. But however you decide to do it, I do encourage you to find some information that you can share that you already have, connect it to an outcome like I did with the patient infections, or whatever outcome you want to use, and share that so that people can see the impact they're making on patients, either positive or negative. Thank you, friends, for joining me today, and have a great weekend. I'll see you back next week.